I think, if I'm not mistaken, this is Dr. Kevin Kavanagh, retired physician and founder of Health Watch USA, national organization. And I believe, Kevin, if memory serves correctly, I certainly do keep good track of this stuff, as you know. Is this our 100th broadcast?
Yes, it is. 100th broadcast on COVID-19. And if you could remember, Jack, when we started out, we were thinking this was going to last maybe 2 weeks. Then sports will come back and, we'll have the sports person on, COVID will be gone. And that's just not the case.
Yeah, I know. And the whole thing has been so politically divided. That part has kind of surprised me. Has it you?
Well, it has. And I think you can see that even in this election. Although the exit polls didn't really rank COVID as number one, even on the Democrat side, you can see by the voting, for example, Michigan and Wisconsin, you'd have to ask yourself if they weren't in the midst of a horrible COVID-19 spike, worse than Kentucky, much worse, would things have gone the way that they were? And the other thing I thought was very interesting was really the group thinking that occurs between the Republicans and the Democrats. And you're seeing this now. And this is related to how you voted. The Republicans voted the day of the election because COVID-19 wasn't a big deal. And I think similar to wearing a mask, they didn't want to send in mail-in votes. The Democrats believe COVID-19 was a severe virus, which of course I also believe, and they mostly voted by mail. And so that's, I think, is fascinating. And you call that groupthink. In other words, where you get a group of people and they all start thinking the same way and absolutely cannot see the other side. And so we're kind of seeing this with COVID-19. And certainly with the amount of deaths we're seeing nationally, in the state, the cases are skyrocketing. We really do need to start thinking with the group that's respecting this virus.
Well, I saw something this morning, and I went back and I used stuff on the air, and then I filed it in file 13 down there on the floor, and I can't find the first story, but there was a story this morning that indicated that COVID-19 is not particularly affected by the weather. One time we thought that when summertime got here, it might go away, and of course it did not. And this is a second report that came in, another source that says, why do viruses spread more easily in the winter? We think it's because of the cold and because we tend to stay indoors more. But a new study thinks radiation from the sun plays a role too. UV rays kill viruses, and we don't get as much of them in the winter. Now, do you agree with that?
Oh, yes, I definitely do. And we've talked about how the sun can sterilize or sanitize items much quicker than if they were just left indoors. Certainly, cold tends to preserve the virus, and gathering indoors that will spread the virus. And we saw that really in the southern states during the summer, where really it's almost like the winter up here. You just can't go outdoors. It's 110 plus degrees. People gather indoors. You're more apt to spread the virus. So it's not a thing that you average out the day. It's whether or not the weather will cause you to engage in a single dangerous activity during that day that will spread the virus. And in general, extremes in temperatures will do that.
I did Army training at Fort Bliss, Texas, which is in El Paso, which is on the Mexican border from Juarez. And I understand the coronavirus is no respecter of borders. Tell us about that.
Well, that's true. The coronavirus doesn't respect borders. We saw that in Kentucky, where actually people were saying it's only going to be in the big cities, and our greatest outbreak was Warren County early on, if you can remember that, and it's still a major focus of COVID-19. And El Paso is another area that is now having a resurgence. Those of you that think that there'll be herd immunity, well, that was predicted in Texas from the first wave. Now, unfortunately, they're into a second wave. El Paso's running out of hospital beds, field hospitals, etc. And regardless of what you think of this virus, if you start running out of hospital beds, you have to open up field hospitals. That will cause the fatality rate of the virus to go up, but it will also start to limit healthcare availability to other people that need to get treated, and then you start to get collateral damage from the virus. And so this is very disturbing what we're seeing. We're nowhere near getting herd immunity, and as I've stated before, that would probably take 2 years to get, and by that time with the coronavirus, you're probably going to get reinfections. I would not bank on that, and you'll for sure get between 1 to 2 million deaths. By Thanksgiving, we're looking at 250,000 deaths. So that is far too great of a price to pay for a strategy that probably will not work.
Here's a text from our auto tech service text line from Bob that says, we've been wearing masks and our COVID cases don't seem to be affected. What gives?
Well, the problem is the premise there. No, you're not wearing masks. Certainly not down in Somerset. The health department is so fed up with it, they're not even going to go over event plans because nobody is following items. Nationally, about 2/3 of people are reporting that they wear masks regularly, but it won't work nationally with 1/3 of the people not wearing them. So that's really false news. I don't know if he lives in the same Kentucky that I live in, but I'll tell you, out in the rural areas, it's not being followed. They haven't followed public health advice, and it's really, really caused a toll. Let's face it, masks worked in SARS, they've worked in MERS, they've worked with Ebola, they've worked with all sorts of different viral infections. So to somehow to think that magically they're not going to result in an improvement with the COVID-19 pandemic is ridiculous. Now, I need to add that when you wear a mask, it works more for the person who's not wearing the mask. In other words, prevents you from spreading it to the other person. So everyone needs to wear a mask. That's key. A mask will help you a little bit from getting an infection, but it's mainly if you're an asymptomatic carrier and you don't know it, it prevents you from spreading it to other people.
And let's go to the phones. This is Laura. Good morning, Laura. You're on with Dr. K.
Good morning, Doctor, and good morning, Jack. Listen, the whole idea of our medical system, the way it's arranged, it's to turn a profit, and it's scaled to do that. And unfortunately, the virus doesn't just pick out paying passengers. It's getting everybody, even those that can't afford it. So our whole population is likely to come down with it. So we actually need more medical people, right? I presume the ones we've got are getting tired. And with unemployment and everything, the bottom line of medical personnel in the hospitals are the nursing aides, and that's like a 2-week course. Why can't our government make that 2-week course free? And if we really need to upgrade that job to a paying enough of a wage that people can live on it, and providing health insurance for those people too. Just an idea. Now they'd come in probably at the bottom of the system with the less critical patients, but then the more experienced people could move up to where they're needed.
All right, I'll let you listen to the answer off the air. Thanks, Kevin. What do you say?
Well, I agree with that. We definitely need healthcare reform. We need to get a universal healthcare system. This virus doesn't discriminate between populations. If you look at Singapore, their 4th wave was from the migrant workers who didn't have access to their healthcare, and it spread to everybody else. Infectious disease does not discriminate. And yes, we need to support our frontline healthcare workers even more. We need to get the Defense Production Act up and running so that they have enough PPE. We need to have them covered with sick leave. We also need to have them covered with workers' comp. If they get COVID-19, it should be presumptive workers' compensation. They can have long-term problems from COVID-19. A study out of Scotland showed that 1 out of every 6 hospitalizations there were either healthcare workers or their families. And you can ask, well, how common does it spread to their families? Well, there's a recent study from the CDC looking at healthcare workers that were infected, and 50% of them within a month had a family member that also came down with COVID-19. So yes, they are also placing their families at risk. We need to get them the proper support, hazard pay. They should have presumptive workers' comp, and we need more people. And on top of that, we need to have a national healthcare system, or at least a universal healthcare system that covers everybody in the United States. The mechanism of that and the exact way that it will come about, that's up for the politicians and for the public to decide. But the need for it, I think, is undeniable.
You have written an op-ed for the Courier that is of interest to me. Would you share some of that?
Well, it has to do that this virus is going to be with us for some time. Even if the vaccine has a 50% efficacy, if only 2/3 wind up taking it, that's not going to be enough to stop the virus. The virus may well become endemic. In other words, it may just live and smolder within our population. And so we're going to need to learn how to do things differently. And as we've been doing this, some of the things that we've learned are actually a better way of doing things. For example, more people are being exposed to online shopping. When you look at businesses and people that are working at home, some of the businesses have realized that, well, if they're working at home, they're happier, I have lower costs, and there are now becoming reports that production is even up. The time they spent traveling, they're now spending on their business. So all of this is something we need to look at. And when you look at schooling, I think blended programs may be here to stay. It allows smaller class sizes. It allows independent learning. It may not be a horrible idea to work into the curriculum having a couple days of independent learning of the child at home, because those are skills they need to have when they leave school. You have to keep learning throughout your life. And that's the gist of the op-ed, is that this is transforming society. It will not go back to the way it was, even if COVID-19 disappears.
Well, show number 100, I guess we can put it in the books. We've got just about 30 seconds. Give us just one or two more statements here.
Well, please, socially distance, wear a mask, and that means a well-constructed mask that's well-fitted, that's over your nose. If it has an exhalation valve on it, put a sticker over that valve. That will help. But please wear a mask, socially distance, and if you can, during the severe peak, try to shelter at home. Thank you.
Thank you very much, Doctor. We'll talk to you Monday.